let's get into the interview. So we have Andres Sanchez, our internal medicine here at Veterans Care International.
Good night, everyone. I say to all the veterans that the best internal medicine in this
The
program.
best internal medicine in the world, right?
Yep.
We have him here at VCI. So Andres, do you mind introducing yourself, just telling us how long you've been a doctor for, how long you've been with VCI, and to just give us a quick introduction of who you are?
Well, in internal medicine, I have like 10 years like physician and like internal medicine 7. I worked in 2 big hospitals. One of the most important was when I do my specialty. It was a military one, the uh, center hospital of the army. This is Santo Domingo, and the other one was a big um, traumatic hospital. I was like 6 years there.
Nice.
So I managed the majority of the chronic condition like hypertension, diabetics, migraines, GERDs, gastro, and all the pathologies that have a chronic evolution. So we manage the medication and the side effect that this medication can have with the other providers.
Nice. Okay, so as an internal medicine, so you touched on hypertension, so that's your heart.
Yeah.
GERD, so the intestines, migraine. So if you have any of these disabilities on your disability breakdown letter, you will be seeing Andres for those specific conditions. So Andres, quickly talk to us about specifically some of these conditions that you see.
Okay.
Yeah.
When we start with the chronic condition, for example, hypertension. Hypertension is a chronic condition. Is a silent killer.
Silent killer, right?
Yeah, because you don't have any symptoms. The majority of the people come and you check the blood pressure and you say it can getting hard. So this patient have to take a chronic medication, but this medication can have some side effect.
Right.
Some side effect that we have to check.
Right.
So the majority of the patient come to many disabilities. So maybe they take in some medication for the pain that can damage the kidney.
Right.
So in the program, we check all that through the therapy, psychologist, psychiatric, and we check the lab tests. We have the day that we take the test, and even though if we need to see any X-rays, we work with that. And it's just a week. We need more time, but we start with that days, and we give the follow of that patient. The majority of the patients that come back.
Right. I love how you say that. Yeah. So, like Andres said, a couple points. We do provide, based on your disability, we'll provide you with a lab test, which again, the doctors will review with you. We'll see if anything's wrong, if they need to inform you of anything. Also, if we need any X-rays. I know also Andres provides EKGs here at the location. So if you want an EKG, you can ask us and we'll give that to you. So perfect. And yeah, like Andres said, a lot of people end up coming back because, and again, this is a highlight that I must say about Veterans Care International is that you are getting, I know when I mentioned all of those services, you're getting that in 1 week, right? So it's not something where you have to see your internal medicine and it takes you a month to see the psychiatrist, and it takes you, and there's this huge gap between every appointment where it's harder to, as doctors, collaborate to really find the most effective way of treatment. A main benefit is that all of the doctors work together. The appointments are really close together, so we're able to work as a team to find the best way of treatment. So, Andres, another question I have is kind of about, on that topic about the doctors working together. Like, can you explain a situation where you kind of had to work together with the different doctors to find the best solution for a patient?
The most important thing is remind that the veterans are their main reason of this program. So we take the time. The first thing that the patient's gonna see is the general practitioner. He's gonna see all the pathologies that have the patient. Is going to organize the program. So, for example, I see the patient that have migraines. The majority of those patients that have too many symptoms in a week, we have to provide the medication in the moment that they have the migraines and a preventive medication. So sometimes we work with the psychiatrics, so some medication that have some side effect with the that can release the migraines, can help you with the insomnia.
Right.
So we can give you the best medication, the lowest dose possible, and the less quantity of medication
Right.
for that. So we like to improve that. For example, with the orthopedics, is the manage of the pain. We see if it's the lungs, the kidneys, the heart is available for some kind of medication or the other kinds of medication. So we work like a team. The patient is not individual. It's not a patient that you have one doctor. You have all the programs that work for you.
Good.
For a week.
Yes.
That we continue this program. If you come back, we have your medical record, and we can organize another activities, another labs, another studies that can provide better health.
Good. Love that. Love that. So yes, we do teamwork. You think of VCI not as individual doctors, but as a team of doctors with all the different type of specialists to help you make sure. And our number one goal, and I always say this, is that you leave here feeling different, right? We want to really treat whatever you have going on the best way possible. And again, it's only a week, so we can only do so much, but we really try to do the most possible. So, Kara, I don't know if you have a final question for Andres.
Yeah, I do.
Perfect.
So, if veterans have any questions or concerns about any conditions that they are service connected for, is that something that you're able to help them with while they're here?
When they have any condition that is not service connect,
Right.
um, we like to see the patients with all the pathologies. Even we cannot give the manager of that. We can give advices. We can organize the medication that they're already taking for because sometimes they have some pathologies that there is not service connected, but can get worse or better with the management of the first ones. So I would like to introduce the patient that we have these pathologies, but I would like to know all your medical history, all the things that you have, and any question that you have, because there are so many patients that are taking medication for years and never had the time to take a time with a doctor.
Right.
So we like to give you the time. You have the control of that interview.
Right. I love how you said that. Like, that is so true. And that is feedback that we have received. We understand how it is, and we want to be better in every way, shape, or form. So there is no time limit. There's no 15, 30-minute, in and out. Like Andre said, we want to hear everything that's wrong. We want to hear even what's outside of the service-connected disabilities. We want to just check, even if everything's good, but just to have a second medical opinion, or have someone just check and give you another perspective, or maybe some education on what you're taking right now. Even if it's not service connected, we are here to help. So thank you so much, Andres, for coming here and having that quick interview.